Hi, I thought I'd send you a quick video, just in case this can be found quickly and easily. We might not have to meet, but I'm still very happy to meet. My Friday's looking pretty good for a Zoom session. So I looked out on the open web, and there was a lot of private industry stuff, like insurance companies saying our wait times are much less, or hospitals saying our wait times. Do you remember on the freeway when you'd be leaving rural areas in Utah, and there'd be like a hospital that would say our wait time is currently 5 minutes. You don't see those so much anymore, but that was before the pandemic. So I suppose if you're bringing somebody back with a broken arm, um, you know which hospital to go to. I don't know. But for mental health, the wait times has influenced policymaking on like telehealth or how what do they call it? Rapid appointments, rapid input, something like that. There's all sorts of decisions that are made off of that metric of wait time. And I went to USA.gov, the CDC and the VA hospital, Government Accounting Office, and other publicly funded organizations do account for that. So try USA.gov, and you can use just regular language searching. But then I found an article that was publicly funded in PubMed, which we have access to, but that's on the open web as well. And I got some jargon that made me think, well, maybe we can track this down. So let me show you what I found. So if you go to advanced catalog search, I found the rhetoric was pretty consistent. Awkward pause. Where they called it wait times or waiting times, not YT. Wait times or waiting times, and mental health. I put it in quotes so the two words stick together. And then I wanted it to be from some time in the recent past. I found stuff that was like from the 80s, and I'm like, this is not helpful. But you can do last 5 years, last 10 years. Material type, you can do, we just want articles. There's all sorts of different ways of narrowing it down. And then there's quite a few. Um, and as everything in psychology, social work, it's based on populations. So the population is sometimes defined as, there's an age, children, um, or here's factors impacting the need for expedition. So when they talk about the need for expedited services, you can reliably go in and they will have criteria and a definition and hopefully references about, well, what is too fast and what is too slow? What's the evidence that you have for that? But you can also see um, all sorts of different populations and contexts. There's our veterans again, children, gender identity. So these should be things that you would find handy. But wait, there's more. I want to show you another one. How do we find the best ones or the most effective ones? You probably remember this from the lesson that I did if I showed up in your class. But if you do that same search, if we know our keywords are solid, you can go to Web of Science or Scopus. There's a lot of overlap between them. And let's do that same search. And then let's see what the most important ones were. So there's 600 in the last 5 years that have wait or waiting time. That's a nice body of evidence. Wait times. You know what? Let's do a star. And that'll get wait time or times. Waiting time or times. And then mental health. And you could also have this be in the abstract. Or you could narrow it down to specifically the title. Oh, shoot, I forgot to do the year range. I'll do that after the sorting. 540. There's video, there's somebody changing their mode. But let's do since 2019. Is it going to let me? Oh, it is. Limit to those years. Wow, still 262. That's fascinating. Oh, you know why? It's because the pandemic made everyone do stuff on Zoom. I remember meeting with a clinical psychiatrist. I guess all psychiatrists are clinical. Maybe he's a clinical psychologist. But be that as it may, you can click on Cited by Highest, and this might help narrow your search from those 262 and see what's the one that made the most impact. Oh, asylum seekers, substance abuse, refugees, barriers to mental health care. So I'm not seeing wait times on this one. So I'm going to do one more. I'm going to edit my search. And hopefully it'll give me this all back again. Okay. I'll just do the article title. I want wait time and I want waiting time. Oh, now it's just 30. Yay! Ding, 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 ding. We're close with Canada. Waiting time and no-show rate in Community Mental Health Center. What? 1980? I guess we have to do the date range again. Oh, sorry. It's probably like watching paint dry. If there's only 30, I suppose you could go through by newest though, instead of cited by highest. Let's do that. Predicting patient wait times. That'll be a good one. It's pretty recent, using machine learning. There's Australia. There's how they're, so a lot of them are embedded. So there's a scheduling policy. There's a particular population, wait times and costs for children. So does this help? Dig through these articles, and all you'll have to do is go through their list of references, or what they say in the abstract to the first page or so of the article, and you should be able to get some like solid data where they're saying this is the average wait time, and then you should be able to go from there. I hope this helps. Let me know if it doesn't, and we can work further.